We have a very well-renowned, very famous gynecologist and IVF specialist, also my favorite, Dr. Rajni Jindal.
So sweet of you.
Yeah, it's a pleasure to be seeing you again.
Same here, Vinita.
So, at the Maplecon, you've spoken about PCOS and forgotten uterus.
Yes.
Would you like to tell our viewers something about it?
Yeah, definitely, because I think people don't know about it, and even the patients who suffer from PCOD, they don't know about it.
Okay.
So we all know that in PCOS, girls who have PCOD, they don't have regular menstruation. Usually, people would visit their doctors at 15, 16 years of age, that they are not getting their periods every month. And some of these patients, some of these girls also have hair on their face. They have the male type of hair distribution, so that bothers them even more. And then they have acne, so all these problems. So polycystic ovary has a variety of phenotypes or physical features. Some patients with polycystic ovary are very thin and lean, no facial hair, and irregular period. And that is the main manifestation. Irregular periods and stress hair.
I always thought you're overweight if you have PCOS.
No, it's not always like that.
Acha.
You can be lean and you can be PCOS.
Oh.
Even a lean PCOS is one phenotype. One end of the spectrum
Okay.
is a lean PCOS.
So when should a female go to get it tested? What are the symptoms?
Symptoms are if her periods are irregular. She is having menstruation infrequently. Like she has menstruation once in 6 months,
Okay.
one in 3 months, or she doesn't have a regular menstruation. She has to take some medicines for the period to start.
Yeah.
Along with that, she also has hair on her body, which are
But
like
is PCOS can be reversed?
some of it can be reversed,
Okay.
some of it can be.
Curable.
It can be controlled. It's not curable because there is something in the genes which is giving you that. But we can control it. We can keep it under control, like we keep our blood sugar under control. With diet and lifestyle, we can control it to some extent.
Yeah, but does stress also add to it? No.
Because it gives you a lot of stress. Actually, it's the disease which gives you a lot of stress. It's a vicious cycle.
Linked.
Yeah, both the things.
So, any suggestion for young women who are suffering from PCOS or how to avoid having this?
See, there are certain things which we have to cope with, and we cannot certainly avoid. We cannot change our genes. We cannot change our environment. We can change it to some extent, but our genetic makeup we cannot change.
Yeah.
So, advice to the girls would be like, especially those who are obese PCOS. For the lean PCOS, they do need a specialist, They will need to go to a doctor for the problems which they will have. They might have irregular menses, then they may have infertility, then they have acne and all these problems. Later on, they can have, extra endometrial hyperplasia or abnormal uterine bleeding
But
patterns.
PCOS is becoming pretty common these days.
Yes, it is becoming common, and to the tune of 30%, if we say, patients who have problems in conceiving. And the question you asked, like, where lifestyle works the best is in the obese PCOS. The other end of PCOS, one is lean PCOS, and then one is obese PCOS, where the body weight is more. And then you have a regular menstrual, you have menstruity, regular period, plus facial hair, no beard, and extra male type of period. There, something that can be done is lifestyle changes, low calorie diet, lifestyle, weight loss.
Yeah, thank you, Dr. Rajni. That was like really good insight for our viewers. Anything you would like to say for young women watching? Any message?
Yeah, one message, one very important message. I see people visiting oncologists for pregnancy, for not conceiving. They would visit every other day, 2 times in a week. But once they are done with their family and they know that they have a polycystic ovary, they still need to see their doctors. They still need to do an ultrasound done at least once in a year to see whether the uterus or uterus lining or endometrium is not getting thick.
Yeah.
Because that is very common in these patients. The endometrium gets thicker and the bleeding becomes very heavy, and sometimes they are at a 3 to 4 times increased risk of endometrial cancer also.
Oh.
So don't forget yourself, don't forget the uterus if you are a PCOD, always keep it in mind, and especially if you have normal heavy bleeding, you must see your doctor at least once in a year and get an ultrasound done.
Yeah.
If the endometrial thickness is normal, that's fine. If it is
Yeah.
thick, then you must get a biopsy done.
Yeah. Thank you
Thank
so
you.
much for the
Thank you,
good,
Geeta.
insightful information. Something you'd want to say about Mapicon?
It's a wonderful conference. See, I'm a gynecologist, so I'm reading gynae all the time. But once I come here, I get to listen to other specialists. Then I
Yeah.
listen to this lecture on connective tissue disorders. See, medicine is so vast, and it is not possible for a person to be knowledgeable about all the problems.
Yeah.
If you attend a conference like this, which has multitudes of specialists coming and talking on the common topics, and I think it's very good for us doctors for
Yeah.
updating our knowledge.
Yeah.
And we must. It's very good. And thanks to Dr. Vipul Gupta, who's been organizing
Yeah.
this conference in so many years, and it gives us an opportunity to share and learn.
Yeah. Thank you,
Thank
Dr.
you.
Rajni. It was a pleasure always meeting you.